The Script Concordance Test for clinical reasoning and decision-making in the assessment of speech-sound disorders. This cloud-based Script Concordance Test (SCT) system for speech-sound disorder diagnosis is designed using case-based scenarios, incorporating relevant audio files, diagnostic images, and other supporting materials to assess participants' clinical reasoning abilities in the context of speech-sound disorder assessment. The focus of the assessment is not on the professional knowledge of speech-sound disorder evaluation, but rather on how participants apply their knowledge to make appropriate assessment decisions in clinical simulation scenarios. Each SCT case consists of 3 independent sub-questions, which should be answered separately and not considered together. Participants are required to make the most reasonable choice based on their clinical experience and reasoning, considering the background information provided in the case and the hypotheses being tested. For each sub-question, participants must assess the clinical situation, evaluation methods, or test results and select the most appropriate response using a 5-point scale. There is no time limit for answering, but on average, completing 30 case questions takes about 45 to 60 minutes. Prior to the formal test, participants should familiarize themselves with the SCT question format through practice questions. These practice questions can be attempted as many times as needed to build confidence for the official test. The cloud-based SCT system for speech-sound disorder assessment enhances the efficiency of group testing and scoring of clinical reasoning abilities, and can be applied in clinical skills development courses and continuing education for speech-language therapists. It can also be used to compare pre- and post-performance in instructional or online courses to evaluate teaching effectiveness. Next, we will present an example of an SCT practice question to demonstrate the format of the questions and the procedure for conducting the cloud-based SCT test. 1. Logging into the cloud-based SCT system. Please click on the platform link. Once on the page, click the blue Login button at the top right. Visitors can log in using the following credentials to view practice questions. Enter the username ID guest. Enter the password guest123. Click the Login button to access the answer page. Before the formal test, participants will be provided with a designated account and can register with their personal email and set a password. The system will send a link to activate the account. 2. Entering the SCT answer area. After entering the answer area, please click on Practice Questions. A list of 3 cases will appear. After reviewing the case description, 3 questions will be listed below. After reading the case description, please click on Q1 to view the middle 2 columns, such as if you perform/refer for the following test, and the test results are. Then, based on your professional judgment, select the most appropriate description from the -2 to +2 scale. Next, click on Q2. Similarly, after reading, select the most appropriate description from the -2 to +2 scale. The process may include audio files, photos, or videos. Audio and video files can be replayed or moved to a specific time point on the timeline. Hovering the mouse over images will enlarge them. After you have selected an option from -2 to +2 for Q1, Q2, and Q3, you will have completed 1 case question. It is important to note that Q1, Q2, and Q3 for the same case are independent questions, so please answer them separately and do not combine them. (3) Official test answering. When the official test is open, please click the test button to download all the questions and begin answering. After completing all 30 case questions in the official test, you need to click Submit Answers at the bottom of the question area. The system will check for any unanswered questions and highlight them in light blue in the question area on the left. At this point, you will need to click on the missing question and review Q1, Q2, and Q3 to fill in the answers. Once you are sure there are no unanswered questions, click Submit Answers again, then click Confirm Submission. When the system displays Submission Successful, the process is complete. In summary, the SCT is an effective tool for assessing clinical reasoning skills and can be integrated into clinical decision-making training programs to evaluate the effectiveness of clinical instruction. By providing a structured framework for measuring clinical reasoning, the SCT helps identify areas for improvement and supports the development of better decision-making abilities in clinical practice.